we're doing research projects within the long-term care home, or we're doing it within the community. So it's very rewarding when those projects are actually adapted. I'm quite excited about it. My name's Danielle Kent. I'm the Director of Research at Loch Lomond Villa, and I'm from Rothesay, New Brunswick. Mountain bike. I love going to Rockwood Park and Shady Grove to go mountain biking. So I did a lot of sprint kayak over in Renforth. And so I actually went to the Canada Games twice, and I went to national level competitions as a coach. The first time I went, I was about 15, 16 years old. So I trained for 2 years prior to the Canada Games. And I had a great team and a great coach that I worked with. Kayaking is a funny sport where it's a lot of singles, but then also you're working in crew boats. So it is team-based and a solo sport at the same time. So with kayaking, a lot of water training, but as well, a lot of strength and conditioning, a lot of cardio work on land. I would say I was quite studious. So in high school, I was the kid who was often studying at lunchtime and after school. And then in university, I went to Dalhousie University and I started in pre-med. So I thought I was going to be a doctor. But as I got 2 years into the program, I took a couple of kinesiology classes and I realized that my true passion was kinesiology. So I switched to the Bachelor of Science in Kinesiology. I would say, again, very studious. Saturday mornings, 8 a.m., I was the kid in the library. And then I continued my education and did my master's in applied health services and research at the University of New Brunswick. I would say I have to work really hard at it. It doesn't come naturally for me. That's why I've had to create such good work ethics, because I had to sit down and really study and learn the material to fully understand it. I didn't necessarily love school. I do love to learn, but for me, it was always, I want to get the most education as possible because I want to be successful within my career so that I have financial stability so I can do the things that I'm passionate about and have that work-life balance. And I think I've always perceived it that way. I chose to go to Dalhousie University because my mom actually went to Dal to do her bachelor's of nursing there. So my brother also went to Dalhousie, so I decided I needed to follow footsteps like my mom and my brother to go to that school. And I actually chose the University of New Brunswick based on the supervisors who were available there to do my thesis. So for a master's program, you need to look at who would potentially be a supervisor for your thesis and if they actually align with your interest. So for me, University of New Brunswick was the best option. As well, it always helps. They had quite a few bursaries to go there too. It's kind of funny looking at it now. I thought I wanted to be a doctor and work with individual clients. My grandparents were both doctors. My mom is an RN, so I was interested in healthcare. So I wanted to work in healthcare, and so for me, I thought being a physician would be the best place. But as I started studying, I realized that my interest actually lied within community and population-based health, but I more so wanted to help with policies and applied research that would make an impact at a community and population level for New Brunswick as a whole. So we looked at piloting a mobile x-ray machine within long-term care homes, and we included 16 different homes within our region. The pilot was very successful, where we were able to scale up across the province with that project. So another example would be our care assistant project, where we actually introduced a non-clinical position into long-term care homes. So we looked at doing an intervention and control houses to see what the impact would be of that new position. Very beneficial So we found that the workloads for staff were reduced. We found overall resident care was increased. We're able to make a difference for thousands of residents in long-term care instead of maybe I'm only making a difference for just one home if I was more so working at an individual level. So making policies and helping with decision making that helps across the province. I would say that there's 3 answers to that. So the first one would be sometimes internally we realize that there might be a gap and we want to do research on that gap to make an impact. The other approach that we might use is looking at what grant funds are actually available in New Brunswick and seeing if we have any research ideas that would fit that grant application. Other times we actually collaborate with universities or other researchers within the community and brainstorm different ideas at a community level or within the long-term care home that would make a difference. I actually had a roommate and she was working at Loch Lomond Villa and she always had such wonderful things to say. So at the time I was working on my master's and I decided to submit a resume to the research coordinator that was here. There ended up being a position as a research assistant, so I got the job and started my career here as a research assistant. And over the last about 3 years, I've transitioned from the research assistant to the research coordinator and now the director of research. Every day is different. Sometimes I'm putting my strategic management hat on and other days I'm putting my operational management hat on. So I actually manage a team of 6 employees. So some days I really have to work with the different employees to make sure that they're motivated, they're on track, and we're getting our projects accomplished. Whereas other days I really need to be thinking about the future of the department. So what grant funds are we going to work towards? What collaborations and networking do we need to start so that we can start thinking about different research projects? It's almost like I have to put a business cap on too, because I have to consider what is the flow of funds coming into the department and what is the cost of the department to make sure that we have enough funds to do different research projects and to have all the teammates. So when I'm trying to unplug at the end of the day, physical activity is really my go-to, especially with my background in sport. So I do a lot of biking. So wintertime tends to be a lot of spin classes and running on the treadmill as I prepare for the summer months when I get to go out on my road bike, go mountain biking, hiking, being on the water. So physical activity is really where I decompress and relax. I would say working in long-term care and being able to come to the office in person and not working virtually is amazing. I have amazing coworkers. We have a wonderful CEO who's very supportive. So we've been given so many opportunities for me being a recent grad and being in my position. I'm quite excited about it. We're doing research projects within the long-term care home or we're doing it within the community. So it's very rewarding when those projects are actually adapted and scaled up for the entire province, or you receive further funding to actually change it into a program instead of a project. Definitely completing my master's. So I did it between 2019 and 2022, so during the pandemic. So I was quite isolated during my master's, writing this big thesis. So for me, when I actually got to walk across that stage and get my diploma, that was one of the most self-rewarding moments I've ever had. So I love New Brunswick because we have so many great outdoor activities. Like I said earlier, we have Rockwood Park right in our backyard, which is fantastic. It's a 5-minute drive and you're out in the woods and you can't see any cars. when you're in a big city, you don't have those same opportunities. It might take 2 hours to get out to a nice outdoor environment, and you might see a bunch of people there. But in New Brunswick, we really do have so many fantastic outdoor activities. I think for research, it's really important to remember it's not a sprint. It is a marathon with research projects because it takes quite a bit of time between ethics, your intervention, data collection, your data analysis. So don't get frustrated if there's a hiccup because it will happen. And you'll feel successful once you overcome those barriers. So work-life balance is really important. If you're treating your career like a sprint, you will get burnt out very quickly. And so you need to think about what you can actually do within the run of a day and what can you do in the run of a week, because you need to be in that profession for quite some time and you need to figure out a way to decompress at the end of the day. So for me, physical activity, it might be something else for someone else.